Well, most of the introduction comes from the huge clinic that this Betty Ching handles up at the Cleveland Clinic. They have a device population that they follow up there that is huge compared to any of our individual hospitals down here. And as a result of that, anything that can be done to streamline the follow-up of the patients and to help keep track of that many individuals they're a groundbreaking center for doing that. So we're very lucky to have somebody in here that's got a vast amount of experience with the patient population at the Cleveland Clinic, where they go from looking at remote data to analyzing remote data to scheduling the patients for actually coming in for their actual device checks. So any of the more complex follow-up questions you can think of, we'll have to give you a prize if you can stump Betty Ching, because I think she's seen it all.
Don't ask me too hard a question. Well, I'd like to thank everybody for having me down here. It's nice to stay in our home state and, go from the top to the bottom and try to educate some people, because I really like taking care of patients. That's why I'm a nurse. That's why I do what I do. I just like doing this. When we go through this, what I'd like to do is just have it open-ended. If there's a question you can think of as I touch on something, just, shout out. Stop me, ask me any questions you might want to talk about. So I thought doing this, you might want to know what we did in the past. And I've been around a while, and I'm not that old. This is brown hair. I never had any kind of color of brown hair. In pacemakers, when we first started, we just had pacemakers, and it was landlines only. And this has come into play lately. How many of you, when you went on remotes, you had this big discussion about landlines? We were limited to receiving one lead from an EKG. Patient had a box with bracelets at home. We would have them put a magnet on the pacemaker. It would just tell us the magnet was okay or not. We had ICDs that required clinic visits every 1 to 2 months. Can you imagine going into your clinic every month? And no data was obtained from the device. I heard people saying, well, they looked at my device and said I didn't have any atrial fib. We didn't know that then. We just knew that there was a device, and the patient came in, and we looked at it. So currently, we have both pacemakers and ICDs that are eligible for remote transmissions. How many of you are enrolled in remote service for your device? Good job. Uh-oh. Was his arm supposed to be up? Congratulations. Remote transmissions and remote follow-up is a way that we can be proactive in helping to take care of you. So we have remote transmissions from home. You have no interruption to your normal schedule. We've put these devices in so you go about your normal activity. It would be off of us and say, well, go about your normal activity, but don't forget to come see us every 1 to 2 months. Take a day off of work, drive in. No driving to the clinic. A lot of our patients, we're in the center of Cleveland. They hate driving downtown. The roads, the congestion. Our building is 160 acres, or many buildings. It's very difficult to find your way around unless you know exactly where you're going. And the big thing is no paying a $10 parking fee. That's a big problem. $10 is $10. And then depending now on your follow-up clinic's protocol, you may only need to be seen 1 or 2 times a year, as opposed to being seen every 2 to 3 months. So it's cut down a lot on your trips to the physician. A lot of my patients say, I thought retirement would be fun until I got sick. And now I have every doctor's appointment in the world. So if we can get rid of some of them, or if we can allow you to go back into the workforce and do what you want to do, it's much important to us. So what are the benefits? And that's Will Robinson. Remember the Boston space robot, Danger Will Robinson, Danger Will Robinson. Well, the benefits for you, it's an early warning system. Any issues that may come through your device. As the device notices an alert, you may not even be aware of it. It may be an alert because you've developed atrial fibrillation. It may be an alert that says your battery needs changing. It may be a simple alert that has, they have AFib, but it's longer than usual. So we just need to know these alerts. And these alerts are transmitted to us. It's sent to the follow-up clinic. We can access this data, call you, ask you what's going on, all from home. We can develop a plan of action before or you have a problem. This may be something as simple as, we only got part of your transmission, can you send us another transmission? It may be, how about scheduling an appointment in a few days, weeks, or months? We want to see how this is going. Or we may want you to send another transmission in a week. We may have started a different medication for you. We want to see how you're doing, and the device data can help us analyze that data. We may say, please go to the emergency room. We'll fax the data to them. Therefore, they have your data. When you come in the door, they know why you're there. Plan of action that's crucial and made just for you in regards to the data from the alert that we've received from your device. So those alerts can be, it's reached an elective replacement interval. It's not like your light bulb at home, you turn the switch on, the light bulb burns out. All of you know we have plenty of time to plan on changing your device. We have up to 90 days once it reaches its time to change. So it's not like I have to drop what I'm doing, go to the doctor's office and wait until I get a change. You can plan your life, well, you know, I'm going to Las Vegas. I'm going on vacation. Sure, go on, have your vacation. We'll change it when you come back. It will still work. We can discuss date and time for change out. Once we've decided it's time to change it out, there's no need for an emergency room visit. There's no need to seek intervention and help as soon as you can. Some devices also have an alert for you. It may be a tone alert. I heard somebody pick up the cards from the Medtronic booth. Okay, that's their alert. St. Jude, I call it a shaking tracks. The whole side will shake. You will not forget that morning. It's just an alert. Alert you that something's going on while it's sending us an alert. So how do we do remote transmissions? Well, most recently implanted devices within the last 2 to 3 years are capable of what we call wireless remote follow-up. It simply means you get a transmitter, it plugs into your phone line, or it can be cellular driven. It will automatically every night check your device. Hello, Mr. Smith, how are you? Mr. Smith's device, how are you? I'm fine, I'm tired, but just let me go to sleep. If it finds there's a problem, it's going to send a message to us. And it'll be available for us on the website in the morning. And we can call Mr. Smith and say, Mr. Smith, your device found a problem last night. How are you feeling? So any device in the past 2 or 3 years is capable of wireless remote follow-up. Some of you may have a device that's older than that. You still may require a wand to send us a transmission. And you know which device you have and what equipment you have to use it. And as we look around the room, you can see everybody's got their transmitters here. The important things to know is when you're approached about remote follow-up is what kind of phone system do you have? Do you have a phone system or do you have a cellular system only? Does it come in with your cable TV? We have a big problem with phone providers because all of us are looking to make our life easier by bundling things together, bundling in the cable TV and the internet and the phone. So we just need to know what kind of phone system you have. So if you're not enrolled remote and you want to be enrolled, make sure you check that out before you go see your physician. So we want to know what kind of phone service you have. Then check with your follow-up physician about the availability of remote follow-up for your particular device. As I'm saying, almost all devices can be followed remotely, but you need to find out from your physician if they follow their patients remotely.